Would you give me another? Okay. Good evening, everybody. I am from the Prostate Wellbeing team, Dr. Richa Sugan. I'm sure you all must be keeping good health. Today, we are going to discuss a very important topic, the renal calculi. Renal calculi, or what we call the kidney stones, are hard, pebble like pieces of material that form in one or both of your kidneys when high levels of certain minerals are in your urine. Kidney stones may vary in size and shape. They may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems, such as a urinary tract infection or what we call the UTI. To throw some more light, we are delighted to have with us the very renowned urologist who shall be here with us, guiding us through on the topic. Dr. N. Satya Prasad, MS, M.ch, Urology. He has a rich experience and hands on expertise in urology, BPH, and stone management. He's currently practicing at Satya Kidney and Multispeciality Hospital, Rajahmundry. Dr. N. Satya Prasad has a vast experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that the patient's health is in safe hands. We are really delighted to have you here with us, sir. With your permission, we shall begin the session.
Thank you. Good evening. We'll
Good
start.
evening.
Yeah.
Well, beginning with the first question and the very basic one, we would like to know what exactly are kidney stones.
As already you mentioned, the kidney has different functions. In that, one important thing is it filters the blood, and the waste material will go through the urine. So in that, there are many minerals will be excreted in the urine. Sometimes these minerals get crystallized, deposited on one on another, and they form stones. So, for example, calcium will mix with oxalate, or calcium will mix with phosphate. And when there is some small nidus inside, they will get deposited on one another and they form stones. So these are the natural substances what we take in our diet, and which were excreted in the urine, which when they are present in a greater number, then they will get deposited and they form stones.
Thank you, sir. So, very well stated that excess of minerals in the diet may deposit and cause the kidney stones. So,
Yeah.
once a person has a kidney stone, what can be the possible symptoms?
Yeah, when patient has stones, it depends upon size, location, and whether it is unilateral or bilateral. If the patient has a stone in the kidney, usually when it is small and it is not obstructing the kidney, the patient may not have much symptoms. He may have a mild pain for the kidney area on the back. But if it get obstructed, then the patient will get severe pain. So what we call that as a renal colic. The patient will get severe pain, nausea, vomiting, and occasionally if the kidney gets infected due to the stone, the patient will present with fever and chills also. So these are the symptoms when one stone is in the kidney and it is obstructing. When the stone is in the tube, then the ureter, which is called ureter, which connects the kidney to the bladder, and it is in the stone ureter tube. And the pain depends upon the location of the ureteric stone. If it is in the upper ureter, the pain will be there in the back and it will radiates to the front. If it is in the lower ureter, the pain will be there in the back and it will comes up to the uh, scrotal area or penile area, or in females to the label area. Sometimes, you know, when the stones block both kidneys, patient will have, no, they will land up in renal failure, kidney failure, and they will have decreased urine output and all the problems with acute renal failure. Okay. Sometimes stones can be silent without any symptoms. They present with like symptoms, unusual symptoms, like they mimic like back pain, and sometimes they will be like bleeding in the urine. Sometimes there will be like pus in the urine. Sometimes they present only with a mild fever. So these are the unusual symptoms, and we should be mindful of the symptoms. Not always stone present with a severe renal colic pain. Yeah.
Right. So the symptoms may vary depending upon the size and the site of the stone present. We already
Yeah.
discussed a part of it, the causes of the stones. Can there be any other causes of the kidney stones apart from the ones we discussed in the first
Yeah.
question?
So the cause of the stones usually were mainly we can divide into due to dietary aspects and decreased urine intake. So and decreased water intake. If the patient is taking less water, then they are high likely that they form stones. And also, if they are taking high animal protein diet, so like red meat and everything, then there's high chance of getting stones. And patients are having taking refined sugars, then also there will be high risk of forming stones. And sometimes stones can be like familial, like in conditions like cystinuria, and there are some conditions like hyperoxaluria when they are having problems with uric acid metabolism, and these are a patient will secrete more calcium in the urine. These are some genetic conditions also in which the patient may get stones. But usually with the stones, what we see are mainly dietary and due to decreased water intake.
Thank you, sir. So mostly dietary and also depending on certain conditions, a patient may or might get kidney stones. Well, in
Yeah.
the very first answer, you mentioned that the stones can be in any of the kidneys. Is it possible to have stones in both the kidneys at the same
Yeah,
time?
most of the time we see both kidneys we will see the stones.
All right.
Yeah.
So after the diagnosis with kidney stones, do all the stones require surgery or medicines could help
Mm,
in certain
yeah,
cases?
as I told you, the non-obstructive stones, the stones which are not blocking, and the stones which are less in size, like below 7 or 8 millimeters, which are present in the kidney, can be managed conservatively. Those stones which are in the tube, ureter tube, which joins the kidney to bladder, if they are less than 4 millimeters, we can wait with conservative measures like giving more water and giving some medications to let the stone out. And like that we can do. But if the stone is more than 6 millimeters in size, it is unlikely to come out. So it needs some or other intervention to remove the stone. So it depends upon size, number, location, whether it is unilateral or bilateral, the patient is having infection or not, the patient is diabetic, or if the patient is having single kidney, then all these things will determine whether we need to do surgery or not. Okay.
Okay, so taking into consideration various factors and then the line of treatment can be decided. Well, doctor,
Yeah.
you mentioned about the fluid intake or the water intake. What should be the optimum level of water intake a person should take the fluid intake for a day to prevent the formation of kidney stones?
Yeah. As you know, water requirement may be different from individual to individual. So what patient with stones should make a notice, they should drink water such that 2 liters of urine comes out, because some may require more water, some may require less water, but the idea is to get 2 liters of urine per day. So if the patient with stones get 2 liters of urine per day, most of this stone formation can be prevented. Usually it comes around 2 to 3 liters of water per day. So it varies from individual to individual, but a patient should take around 3 liters of water so that they get 2 liters of urine minimum per day. Okay.
So enough water to produce 2 liters of urine a day would
Yeah.
probably be
Yeah.
sufficient. Okay,
Yeah.
okay. Thank you. Thank you, sir. And moving forward to the next question. Once the kidney stone is treated and the patient is said to be fine, is there a chance of recurrence of the kidney stone in a particular patient?
Definitely, there will be a chance of recurrence because most of the patient they won't change their lifestyle, they won't take much water, they won't change their diet patterns, and they forget the incidence within 6 months to 1 year, so that the recurrence rate is high. There is a study that there will be chance of second stone formation, 100% formation within 10 years of time. So they should be very vigilant, and they should be like because most of the stones will be formed in high temperatures in summer seasons. They should be more vigilant, take more water in the summer, and they should avoid dehydration. Dehydration is the main cause which forms, no, which changes the pH of the urine. And in the acidic pH, most of the stones will get deposited. So they have to avoid the dehydration in any say like any given part of the year. They have to whenever they are going out and they are exposed to sun, they have to take much water, especially in summer seasons. So like that, we can prevent to some extent the stone formation. Okay.
Thank you, sir. So being hydrated is the key to prevent or the recurrence or even the formation of the kidney stones in the
Yeah.
very first stage.
Yeah.
Well, any particular dietary restriction that we could take up, any vegetables to be avoided, any particular sort of food,
Yeah.
the red meat, any other
Red
foods
meat
that can
and
really cause.
protein should be like protein recommended dietary protein. Like animal protein is it's like around 52 grams per day. Should not more take more than 52 grams per day, and you should avoid taking high salt intake. And also you should know we should not take too high calcium or too low calcium. Calcium supplements, high calcium supplements also are they are very they can form stones, and too low calcium also can also form stones. So there should be optimal amount of calcium intake, and oxalate rich vegetables and should be avoided, like spinach, rhubarb, and the nuts and grapes, especially in the nuts, cashew nuts. Almonds are also like they can form stones. So there are some list of vegetables they should be avoided. They should be avoided, and especially when taking like they should be encouraged to take like fruits like watermelon, pineapple, and tarbooj, and all these things will help in less stone formation.
So there can be foods which can reduce the chances of stone formation, and there can be stones which can accelerate
Yeah,
the chances of stone formation.
citrus fruits like oranges and lemon, they also can reduce the stone formation. Yeah.
Okay, so oranges and be staying hydrated and having the optimum level of calcium intake, not more than what is required, can be the key for the prevention. Thank you so much, doctor. We shall shortly have a few questions from the audiences as well. We've got the show live on our YouTube channel, and the entire of the nation is watching the show. A lot of patients who are going through the pain of kidney stones, or maybe their relatives, their families, their friends are going through the
Yeah.
same kind of pain, might have a few questions for us.
Yeah, there are two questions in my chat, but they are asking about the BPH. So Manoharan and Abhishek saying they're asking about BPH, but this talk is about stones. Anyway, I add one thing: BPH when the patient recommended to undergo surgery. So it depends upon the size of the gland and its symptoms. If the symptoms are more, they have to go for surgery. And Abhishek Sen has messaged that there are any alternatives or complementary therapies that may support prostate health. Usually, treatment depends upon size and symptoms only. And there is a like treatment like watchful waiting also when prostate is like even though it is weak, it is not causing symptoms. We can watchfully wait for the and observe whether the gland is growing or not, the symptoms are coming or not, and we should be avoiding coffees and alcohol, coffee, and high water intake in the evenings, and some cold medication. These all can aggravate the prostate symptoms. Avoiding them can also help in getting the prostate symptoms get treated. But no questions are there around on actually stone management. So
We've got two more questions now in the chat
yeah,
box.
yeah,
Mr. Abhishek Sen has another question. I think doctor has already answered the question. I need to know that what all food can I avoid in kidney stone? I'm 30 years old. I think Dr. Prasad has already answered these questions, but
yeah, yeah.
if you can quickly go through a recap.
Yeah, tomato. The Manav Sharma has asked that tomato is bad. Yes, definitely. Tomato they should not completely avoid it, but to take in a lesser quantity. That is enough. Okay. Previously, like cauliflower, uh, cauliflower and broccoli used to be there in the foods to be avoided, but now there is a revision that they can be taken. And
Are there any medications that can help prevent the formation of new kidney stones or manage the
yeah,
pain
uh,
associated?
definitely potassium citrate syrups can be helpful to prevent the stone because it contains citrate, potassium citrate, and magnesium, and they will help in the stone for preventing the stones. And also pain, you can take any regular analgesic, and when you are having severe pain, and if it is not subsiding, you have definitely go to the doctor and see the doctor. And the preventing strategies, if you are having high uric acid, you can take medications which decrease the level of uric acid, like febuxostat. And there are like if you are having high oxalate, there are like medicines to decrease the oxalate level in the oxalobacter bacterial medications are there, which can decrease the incidence of oxalate stones. And thiazide diuretics also will help in decreasing the stone. And over-the-counter medications to help the stone, definitely they should be taken with caution because analgesic usage and in another sense will affect the function of the kidney. So taking too much of analgesics and NSAIDs like diclofenac and everything, they can in another way harm the kidneys. How much water should I drink daily to reduce the risk of kidney stones? Deepak has asked this question. And you have to take water so that you will get 2 liters of urine per day.
So enough water to produce
Okay,
minimum liters of urine per day can be
two
a
liters.
great
Yeah,
preventive
yeah,
measure.
yeah.
So, sir already mentioned that staying hydrated is the key. Thank you so much, Dr. N. Satya
Stone
Prasad, for your.
management. Yeah, yeah,
Yes,
yeah.
sir.
Thank
Yes,
you.
sir. Yes, yes, sir.
Stone management, have changed a lot from open surgeries to PCNL to now the advanced laser surgeries. So no need to worry. But and it's not a big deal now to deal with stones. But the key is everyone is focusing on how to treat the stones when they are found. But preventive aspects are very important. Patient should also be mindful that if you got stone, you are high likely that you will get a stone again, and should be mindful of what you are eating and how much water you are drinking whenever you are going out also, and whenever you are exposing to high sun and dehydration, you should be cautious enough to take much more water. And there are medications like potassium citrate syrup, which can help in preventing the stones in summer season, formation of new stones. They can be taking the stones. Okay.
So the potassium citrate syrup that you mentioned, sir, has to be taken over the counter or under the supervision of a doctor. If a patient had
Supervision
it.
supervision is always better because um, again, like what the type of stone, some type of stones, potassium citrate syrups will cause more harm. So definitely it should be taken under supervision.
And if
Okay.
the once the patient is treated with a kidney stone, how often do you uh, recommend for the follow-up? How often should the patient visit the doctor for the follow-up? So to
Yeah,
understand if there is a
every 6 months they should come. Yeah,
So even after being treated for the kidney stone, you must visit your doctor, your urologist, after 6 months at an interval of 6 months to 6 months to ensure that there's no recurrence. And if at all there's a recurrence, we can get it treated again
yeah. We can treat in a early stage when the
early.
stone itself is small itself.
Yes, the earlier the better.
Yeah,
Thank you. Thank you so much, Dr. N. Satya Prasad, for your valuable time. And it has been quite an informative session for our viewers. You've taken us through all the satyas, the facts on the kidney stones, just like your name. You have been a true torch bearer for, the management of kidney stones and enlightening our patients, our viewers with all the causes and the treatment plans for kidney stones, the dietary changes and the lifestyle changes that can help prevent the stones. Thank you so much, sir. We look forward for many more such sessions in the coming time. Also, a big thank you to the viewers for your excellent participation. For more information and updates, stay connected to our Facebook page called the Prostate Wellbeing. We're also available on YouTube, Twitter, and Instagram. Thank you so much, everybody. Have a good night. Stay happy, stay healthy.
thank you.
Thank you, sir.